So, leukemia, what we understand in layman language, is a type of blood cancer. It's leukemia means a problem that arises from the stem cells. So, the leukemia, usually what happens in the leukemia, there is a stages of maturation of the blood cells in our body. There are three types of blood cells in our body. First is that forms the RBCs that gives rise to hemoglobin. WBC is the second lineage. Third lineage is the platelets. So any problem arises from all these same lines can give rise to leukemia. So leukemia, what happens when we see the WBC, that goes rise from the 1 to 10 stage of the maturation. So when there is a blockade in the maturation of these cells, it leads to the leukemia. So what happens in the normal, the cells matures in the bone marrow from 1 to 10. After finishing the 10, they comes into the circulation. In leukemia, it is interrupted at various stages of the maturation so that immature cells comes in the body. And what happens, and in the bone marrow there is uncontrolled growth of these cells also. This leads to the suppression of the normal cells. When they grow very fast, from 1 to 2, 2 to 4, 4 to 16, 16 to 64, like that. They rises exponentially and they suppress the other normal lineage. Means if you consider leukemia, WBC count will increase very rapidly and it will suppress the hemoglobin and platelet, the other lineage, because the bone marrow is very compact place. It doesn't allow the other cells to grow. So what interesting between the leukemias of adult and adult as and a child. So if you see the physiology of adult and child, if you compare child are young with good organs, their acceptability of the medications is higher. So what happens when you have good organs function, so that we can able to give the highest possible doses of the chemotherapy, their body responds to the chemotherapy quite well, so that we can able to control the disease as well. While in adult, the problem lies because as the age grows, there are other comorbid conditions like diabetes, hypertension, kidney issues, heart issues happens. So these things may alter the doses of the chemotherapy that leads to the deficient in fighting of the blood cancers. So this is the main thing if we compare the child and adult. And the other thing, when you don't deliver the adequate amount of the doses, then the response to the therapy and the control of disease is poor. That's what happen in adults. So the child usually, if you I can say the blanket statement, leukemia in child responds quite well, while the leukemia in adults respond less in less compared to the child. That is a blanket statement. There may be a pitfalls in this statement, but overall picture I am talking about. Otherwise the causes are almost same, radiation and chemicals, and in 90% of patient we don't have any observable causes in leukemia patients. And these all leukemia cells arise from the stem cells. So it's a stem cell disorder affecting child as well as adult, but the child having a very good response. And the genetic factors require the favorable genetic factors that are causing the leukemias are more prominent in the child. So genetically also the leukemias are the stronger in child compared to the adults.
Right, doctor. So you're saying that when a child is younger, is able to take the medication and the treatment in a better form.
Yes, better form, and his body can able to tolerate also the required doses, because most of the chemotherapy doses are high. So body also has to adapt to those chemotherapy and they have to tolerate, because liver, kidney are the most important organ in excretion, metabolism, and distribution of any chemotherapy medication. So when they are functioning, so there is a good amount of metabolism, distribution, efficiency, and the adequate excretion also, if it is in the harmful doses. So child respond well.